My name is Jim Baxter, and I'm from Ease Seating Systems. I'm here today with Molly Racklin, who's going to be talking to us about some of the fundamentals of seating. Just a little background on Molly. She's been a registered occupational therapist for the last 15 years, and she holds certifications as an assistive technology professional and a certified brain injury specialist. Her experience includes 6 years in the inpatient setting, 7 years in outpatient neurological settings, and she recently transitioned into the role of equipment specialist at Rehab and Mobility Systems. With that being said, I'm going to hand it off to Molly. And I'm not sure if everybody saw on the webinar chat there that Nick has, but if you have any questions, feel free to type them in the Q&A box and we can have Molly answer them at the end of the presentation. So I'll hand it off to you, Molly.
Thanks, Jim. So again, I'm Molly, and we're talking about cushion basics, finding the right seat for you. So we'll be talking about basics of seating and positioning, pressure injuries, and then the different types of cushions. So now, basics of seating and positioning. So the first thing we're going to look at is the actual chair. Now for these, it really doesn't matter. It can be a wheelchair, a desk or office chair, your driver's seat, pilot seat, whatever chair. You want to make sure that you have the appropriate seat size. It's definitely more important for the wheelchairs and desk chairs in this case. So your seat size, you want to go from hip to hip, and then from the very back of your bottom to about like 2 finger widths to behind your knee. If the seat is too wide, you're not going to have really good support from your armrests, whatnot. And if the seat is too narrow, it's going to be pushing in at your hips. If the seat is too long or too deep, it's going to cause you to slouch more or your feet to hang. And if it's too short, you're not going to have appropriate pressure distribution underneath your legs. So then you want to look at your actual seat cushion. You want to make sure that it is the same size as the chair you're sitting on. You want to make sure that it offers you the support you need, and then it's comfortable, because if it's not comfortable, you're not going to sit in it for very long. And then you also want to look at some of the other aspects of the chair, like with the back. You want to make sure that the back is comfortable for you to sit against, that it's not too low where it's kind of hitting in your mid back, or that it's not too high and pushing your head forward. You want to look at lumbar supports, because if it's too big of a lumbar support or not in the right spot, it's going to cause you to arch your back more, which can be very uncomfortable. Or if it's too shallow, it's going to feel like you're not touching and you're going to kind of slouch down to get that contact. In the case of being in some type of wheelchair, you might need some type of lateral supports to help keep you upright. And then looking at your armrests, if they're too far away from you, you won't really have good stability, or you'll be constantly shifting side to side to get some support. If they're too close, they're going to be squeezing you in. If your armrests are too low, it's going to cause your shoulders to drop, you'll slouch, so you get that arm support. Or if they're too tall, you're constantly going to be sitting with your shoulders up, which will again be very uncomfortable, and you won't end up sitting like that for very long. So then when we're looking at your positioning, the general rule of thumb is the 90-90-90 rule. So this is my little positioning guide. And so you want to make sure that your ankles are about 90 degrees, your knees are at 90 degrees, and your hips are at 90 degrees. That'll give you the most upright seating, as well as the most support underneath your bottom. But you want to, it's okay if your feet are slightly more or less than that, your knees are possibly bent back or a little bit forward, and even that your hips aren't always completely upright, because quite honestly, that is not the most comfortable position for all the time. Most people don't sit completely upright all day, every day. The biggest part is that you want to make sure that your feet have good support on the ground. If your legs are hanging, it could cause nerve impingement in your legs and cause your legs to fall asleep after a while, and then make it difficult to get up afterwards. You also want to look at your neck alignment. If you are constantly looking down at a computer screen or at your lap, you're going to be stretching out the back of your neck, and that'll lead to pain throughout even into your back, even your lower back. And then you don't want to have to sit with your head looking up, because that again will put strain on your neck. You'll be hyperextending, which can cause some impingement issues. So you want to make sure you can keep your head looking straight forward. So now, if you have poor positioning in your chair, that positioning can lead to discomfort. It can be from lack of blood flow because there's no movement going on, or because of the lack of movement, as well as, again, nerve impingement, like I was saying with the previous slide. If you're sitting in a long place for a position for a long period of time, that constant pressure will hit the nerves underneath and can cause some numbness feeling. Like people say their bottom falls asleep if they've been sitting too long, their legs fall asleep. Well, these things together can lead to pain. And pain and just, that numbness. You just don't like sitting like that. And also it's fatiguing. If you've ever been on a long car ride, you know that even though you weren't up walking or doing heavy work, you're still tired at the end, because you've been sitting, because you probably didn't have the right support. So these things together lead to a decreased sitting tolerance, where you just don't tolerate being in that chair for very long. And you want to get out of it. You want to go lay down in bed or sit in a recliner, just because those are giving you more support and they end up being more comfortable to you. So again, for people feel like they need to change positions for reducing that discomfort, or is what we call also pressure relief. So you don't have too much pressure in one area for a long period of time. Now, how you do this completely depends on your own situation and who's doing that position change. Now, most people out there are able to complete a change themselves. They might cross their legs or uncross their legs, shift their bottom on the chair, kind of scoot forward, scoot back, or if they'll even get up and walk, they'll move to a different chair, they'll do something to change that. Or if they happen to be in a power wheelchair or a manual wheelchair that has a tilt and space feature, which tilt and space is where you keep the same angle at your hips, knees, and feet, but the whole chair leans back. When you're upright, you have all the pressure is right here and under your feet. But when you go into tilt, you remove that pressure from here and here, and it gets distributed to the back of your legs and to your back. So you completely relieve over here. So if you're in the power chair or a manual chair with power tilt and space, you can do that change on your own. Now, there are other people who, for whatever reason, are unable to make those changes themselves. They may be in a manual wheelchair and someone else might have to use a dependent lever on the back of the chair to tilt them back. So it just depends, or even having that person assisting them, help them to lean forward, help them to shift to get that position change they need. So now pressure injuries. They are defined as a localized damage to the skin and or underlying soft tissue usually over a bony prominence or related to a medical or other device. The injury can present as intact skin or an open ulcer and may be painful. Now, this is the definition by the Joint Commission. That is an agency that accreditates medical facilities like hospitals, nursing homes, and medical labs. So a bony prominence is an area where the bone kind of sticks out in a smaller area. So if you're looking at your forearm, it is nice and smooth. There's no pointing areas over here. Then if you get to your wrist, you have this area here where it's jutting out. Now, over this area, you have skin, you are like some muscle, fat, giving you some protection, whereas over here, there isn't much. So having this pointing down could lead to a pressure issue. So when you're looking at your bottom or where you're sitting, like over underneath this hip, there really isn't any pointy areas. But as you get towards your hips, you have two bones that are sticking down from your hips called ischial tuberosities. Those are a very common area to get a sore because, again, there is and tends to be not as much muscle or fat underneath there. You also look at your tailbone or the coccyx is another hot spot where people tend to get pressure injuries. So now generally these injuries are caused by either a constant pressure there or a shearing injury where they're moving, but the surface they're sitting on doesn't move with them. Now, other factors do contribute to pressure injuries, like blood pooling in the area from not moving around, moisture that can cause a lot of issues, as well, like I said earlier, lack of muscle and or fat between the bone and what is providing that pressure. Now, when a person is unable to feel this discomfort or move when this discomfort is felt, that is when they may develop these pressure injuries. Or let's say you can feel and move that area. However, you've had sores or issues there for a very long time. So your brain's just gotten used to it. So you don't even necessarily realize it's hurting any more than usual. So you don't even think about getting off of that area. Sorry, guys. So now a development of pressure injuries can result in severe painful sores. Now, when you get these sores, there is an increased need for medical care. You generally have to go to the doctor more often, a specialist, a wound care physician, to monitor and treat that wound. And as well as having nurses and or caregivers coming in your home much more frequently to check the wounds, change and replace dressings on those wounds, as well as caregivers who are helping you move and function without damaging that area as much. Let's say prior to your injury, you may have been able to get yourself, let's say, from the bed to the wheelchair just using a sliding board on your own. However, once you have this sore, using that sliding board might cause shearing, which will make it worse. So you might need someone to help you transfer by getting off of that wound, which you couldn't do on your own. Now, you would also, the best way to heal a wound like this is to be off of it. But if it's on your bottom, the only way you can possibly be off of that wound is either laying on your stomach or laying on your sides. To do this, you have to be in bed, and this can be very isolating. You can't go out of your home to go grocery shopping, to go visit friends, to go anywhere. And let's be honest, people aren't always coming into your house to come visiting. So you get very isolated, and that isolation can lead to serious depression because you can only look at the same few walls, the same television, the same magazines or books so many times before it really will start to get to you. The bed rest can also lead to other medical complications. Because you're not moving as much, muscles can get weak and start to atrophy or shrink because they're not being used. And then because you're laying down, internal functions might not be working as well. If you're laying on your stomach or you're laying on your side, your chest can open, can expand to allow a deep breath, or your gravity isn't able to help expel waste product like urine, bowel movements, so you're not functioning as well. So did you know 2.5 million patients per year have pressure injuries, and these pressure injuries cost about $9 to $11 billion per year in the US, and the cost of individual patient care ranges from about $20 to $151,000 per ulcer. What if you had 2 ulcers? That's at least 40 grand. That's insane. And then about 60,000 people die every year as a result of pressure injuries. That is a huge amount of people. That's huge. So by looking at how you're sitting and what you're sitting on can make a big difference. So now we're going to talk about some different types of cushions. We have air cushions, foam cushions, gel cushions, and then alternating pressure cushions. An air cushion is a cushion that's generally made up of multiple air-filled cells that are all connected. So the air is able to move freely throughout these cells. Now, this kind of cushion is considered the gold standard for pressure relieving cushions. It does an excellent job of distributing the weight evenly throughout the cushion because the air can move to provide more or less support as needed. However, because it's such a freely moving cushion, it's a very unstable seating surface. So if you do not have very good balance, you're at higher risk of shifting side to side. And also, some people just don't like that feeling of shifting all the time. They want to be sitting on something more stable. Also, because it's air, there's a lot more maintenance involved because you need to make sure that those cells maintain the proper amount of air. If the cells are too full, the air is not going to be able to move underneath you, and it's going to be like a harder surface. And on the other end, if there's not enough air, you're going to sink in more and again, not get that proper weight distribution. These cushions also do have a tendency to deflate because there's air moving and it's just a thinner material between the outside and the inside of the cushion. So when these cushions deflate, there's really nothing between them and whatever seat surface they're on, which is usually like a metal platform. So as we were saying earlier, if you don't have that proper pressure distribution, especially your hip bones are going to sink right in and just be at constant pressure. And then that's what leads to pressure ulcers. So by the cushion not being maintained, you could really get hurt. Now looking at foam cushions. A foam cushion is a molded cushion made with layers of various open and closed cell foams. Now these cushions are designed to maintain that positioning and reduce the pressure on high risk areas. This could be either by completely cutting out that area or just making more of a opening or more of a valley where those high risk areas are, which again are your 2 hip bones as well as your tailbone. Now the pros of this is it does a much better job at maintaining your positioning of the hips and upper legs and just giving you that stability to make you feel like you're going to be sitting all right. Also, there is much less maintenance and cost involved. You don't have to go and are constantly checking to make sure the air is right and that you're sitting okay on it. It pretty much tells you if you are or not. Now, the problem is though, is that they don't always allow for optimal pressure distribution because there's no way for the cushion to change underneath you. How the cushion is how the cushion is. And if you're not sitting exactly correct on there, you could develop pressure issues because those hot spot areas may not be in the right place. So if you're too far forward, too far back, too far to one side or the other, it's not going to move underneath you. And also, because it is foam, they do have a tendency to break down with prolonged use. You will eventually get that compression after having weight always on there. And now looking at gel cushions. A gel cushion is made of a molded foam base with a gel overlay on top. Now, the pros with this is that it is providing that positioning you get from the foam cushion with the pressure distribution qualities of an air cushion. Because and then the other pro is that there's less risk of shearing injuries. Because while you're sitting on that gel cushion, it does give and move underneath you. So it will help reduce the pressure areas on some of those hot spot areas as needed. And also while you're moving, when you're on a stable foam surface, you move that the cushion is remaining in place. But on a gel cushion, you move, that gel is going to glide with you. So you're not shearing and hurting yourself as much. However, gel does tend to be affected by temperatures. If you're living in an area that has colder climates, that cushion, and let's say you keep your cushion out in your car or you store it in the garage when you're not using it, it's going to get cold when you'll feel the coldness whenever you sit on it, but then the gel will become less pliable. It won't move around as much. So when you go and sit on it, the gel isn't going to disperse to help with that pressure distribution. And also, there is a little bit more maintenance required with the gel because when you get off of that cushion, you kind of have to knead and move the gel around to get it back to that neutral position. Otherwise, especially with a thicker gel, when you go to transfer in, if the gel's already moved in one area and then you go and sit on it, the gel might not move back to where it needs to be to give you that pressure distribution. And lastly, we have alternating pressure cushions. An alternating pressure cushion allows for the pressure to change underneath the user's bottom to provide the pressure relief of an air cushion, but also provides the movement underneath you to prevent the fluids like blood and other bodily fluids from staying in one place. Now, the pros of this is that it provides movement air-braced pressure distribution on that foam base. So you're getting the moving, but you're getting that contoured base to keep your bottom where it should be and give you the feeling of more stability, as well as that it's software powered to monitor and control the air pressure and flow. With that, you don't have to worry about, is there enough air in here? Is it moving correctly? The software with it controls all that for you. However, because of the software and the technology involved in these cushions, they tend to be more expensive. As well as because it's still considered a newer type product, there's less information available. It's less well known. So doctors, therapists, nurses, case managers aren't very familiar with these type of cushions. So they're not going to be able to tell you much about them, if they know anything at all about them, to let you make a choice on what type of cushion you want to sit on. So that is all I have. Are there any questions?
I don't see any questions in the Q&A, but I guess I got a couple questions for you, Molly. First of all, in your opinion, which cushion is the best?
Honestly, for every single person out there, even people with the same exact conditions or situations, no one cushion is good for everybody. There isn't. I mean, what works for one person may not work for everyone else. So the best thing to do when trying to figure out what cushion is right for you is to try them. You'll never know unless you try them. And even what in theory should work the best for you might not.
Okay. And if you, let's say you need a more specialized cushion, who would you talk to?
I would recommend talking to a seating professional. That way you're getting as much information as possible on cushions, and they'll help you to kind of choose what might be best for you, help you to try different cushions. That way, again, you know what's going to work.
Okay. Got a couple of questions here about insurances. I'd like to know how hard is the process for insurance to cover a cushion? How often will insurance buy a new one? And what diagnoses allow for your insurance coverage for cushions?
All right, so first part of that, what insurances will cover cushions? It depends. There are so many different insurances depending on where you live and what conditions you have. Medicare, like let's say Medicare will only cover a cushion, any cushion, if you are using a wheelchair. So if you're not in a wheelchair, they're not going to cover a cushion for you.
Okay.
And then the more general insurances like the Blue Crosses, they probably still aren't going to cover for if you're not in a wheelchair, but they'll be, for lack of better words, kinder in allowing you to get a cushion you need.
Okay.
And then you get into the like workman's comp, depending on where you live, auto insurance, they'll be even more forgiving on what type of cushions you're allowed to get. If you're going through your insurance, you definitely have to have a script from your doctor.
Okay.
That will allow for more of an evaluation as well as take off sales tax.
Okay.
And depending on your insurance, like with Medicare, you need to have something done with a physical or occupational therapist, as well as a supplier who has the assistive technology professional certification, where we would, like myself and the therapist will do the evaluation with you to kind of see what things you might need and to recommend some cushions. With most insurances, once you've had that done, the information then needs to go to your doctor with that and some other forms signed off on. You need to have a face-to-face examination with the doctor for them to, agree or disagree that you need a cushion. And then that'll go to your insurance company. Your insurance company then decides if they agree with this, and that gets back to the supplier, who then can talk with you about the pricing of the cushion and help you go ahead and order it for you.
Okay. So there isn't, I guess, for lack of better words, certain conditions that make you eligible for higher level cushions. It's more of just a process of starting more simple and working your way up to more complex based on person's response to the cushion.
Yeah, generally so, but if there is, how to put this, there's cushions that are considered just positioning, then there are cushions that are just skin protection, and then there's the cushions that are both considered skin protection and positioning. And you have to meet certain criteria for the different types of cushions. Like if you have pressure ulcers, that'll definitely do a skin protection cushion. If you don't have a good sitting posture, if you're, you might qualify for a positioning cushion. So it just depends on exactly what's going on. Again, the best way to find out if you or to find out what might work for you is talking to your therapist and or a supplier.
Okay. I don't think I see any other questions. So I guess I think we'll wrap things up.
Thank you, everyone.
Yeah, we appreciate everyone for attending, and hope you're able to learn something today about wheelchairs and basic positioning principles. So,
if you have any further questions or anything comes up, you can contact Ease Seating Systems and they will get back to me with questions and I'd be more than happy to answer them for you.
all right.
Thank you again and have a wonderful day.
Thank you.